What's up, you guys? It's your local Speechy here. If it's your first time coming to my channel, welcome, welcome. For those of you who don't know, for every video that I create and put out, I will have timestamps in the description below. So if you want, you can go ahead and look and pick and choose which parts of the video you'd like to watch, or you can sit back and watch the whole thing. Today, I will be talking about the ins and outs of speech-language pathology, and all the information and research I compiled for this video will be in the description below. I'll also be linking to other videos that are about speech-language pathology as well, in case you do need more information. Now, to get you guys excited for this video, I wanted to say that speech-language pathology was ranked number 6 in healthcare jobs overall, and number 8 in best overall 100 jobs. So I think that's pretty good.
Wow.
So what exactly are speech-language pathologists, and what exactly do we do? Now, essentially, we are experts in language and communication. So in the speech aspect for speech-language pathology, we are mainly working with how to make someone more effective in how they communicate and how they speak with others. So some examples of the speech aspect in our field would be to maybe decrease someone's stutter, or we could help strengthen someone's facial muscles if they are not strong enough in order to help them communicate more effectively. Or we could also be even called in to help with someone's accent if they feel that they want to change their accent. Along with this, we should be able to fully work with an alternative communication device, which you might have seen them before. It could be a tablet or a more advanced device, but usually there's just symbols in there that you could click or you can make a sentence with, and the tablet will speak for you. Now, a lot of people forget that language is also an aspect in our field as well, so we should be experts in language. And an example of this in our field could be working with someone who might not be able to understand social cues as well as someone else, or we could be working with someone who just doesn't understand and cannot comprehend written language as well as their peers. With all of this, we should also be able to work with people who might not be able to swallow as effectively as they could. And examples of this would be helping a baby during feeding time if they have cleft lip palate and are not able to swallow as well as they should, or someone with the swallowing disorder, otherwise known as dysphagia. We're able to work with babies all the way up to the elderly population, so we have a huge range in our field. Now that we talked about what is a speech-language pathologist, we are going to be talking about how do you become one. And as of 2020, the typical pathway for a speech-language pathologist is to go into an undergraduate speech-language pathology program at a college and then applying for a master's in the graduate program. This goes to say that even if you graduate from college with a different degree, does not mean you can't apply for a master's. You can always apply for a master's in speech-language pathology with a totally different degree if you'd like. So if you get into a master's program with a totally different degree, it's totally okay. The only thing for you is you will probably just have a longer time of graduating, as you will need to take a year or a half year of prerequisite classes before you can take the graduate classes. To apply for a master's, you will typically need to take the GRE, you will need a good GPA, you will need typically 3 letters of recommendation, and usually you will have a personal essay for that specific college. Each graduate program is different, as some may not even take your GRE scores. To become an official certified speech-language pathologist, you will have to graduate your graduate program, you will need to finish all the required hours of clinical work, you will need to pass the national examination, and then after all of that, you will have to apply for a licensure in your state that you live in. I know continuing your education is going to take a lot of time and a lot of money, so you're probably sitting there wondering, well, what's the salary? What am I gonna get? Those who receive the lower half of the pay get roughly $60,570 per year. The median pay in the job is roughly $77,510, And then the top paid speech pathologists are receiving on average $97,770. If you're looking to be a speech language pathology assistant, the range would be between $43,638 to $54,547. The next topic I'm going to be talking to you about is where can you work as a speech language pathologist? And this topic is a huge pro of our field because we are able to work in so many different areas. A few examples I have for you would be in the hospitals, in the school systems, universities. If you do go and get your PhD, you can work in private practices, out of rehabilitation clinics, and you can even create your own practice and start your own business. The next topic is what are the classes like and what can you expect as a speech language pathologist? And honestly, this is the topic that I wish people told me about more, and I wish I knew more about it before going into my program. The classes in the undergraduate program are definitely very science-based. You're going to have a lot of anatomy classes, you're going to have a lot of speech and hearing science classes, you'll have phonetic classes, and there's going to be lots and lots of classes on language development and language disorders. Now the classes are going to be more difficult and you're going to have to work harder for a higher GPA in the program, but I promise if I can do it, you can do it, and you're just going to have to get over that initial struggle and eventually it'll just get better, I promise. For graduate school, it's going to be different because there's a bigger emphasis on clinical experiences and actually getting that hands-on experience that you've been learning about in all your classes. I know for Loyola University in Maryland, they said that they only have classes on Monday, and then for the rest of the week is a clinical internship. Okay guys, that about wraps up this video. I really hope you enjoyed it, and I hoped it helped out a little bit in your research. I will be posting links and information below if you'd like to look into more areas of what I was talking about, and let me know in the comments what I could improve on speaking about and what areas you're still confused about so I could try to help in any way. As always, you are more than welcome to subscribe and like, but I'm not going to force you to. Just know that you are always welcome to come back to my channel and watch my content. I hope you have a nice little day. I'm gonna go watch some Netflix. Bye.